I want to thank everybody for being here for session 3 of the Medi-Cal series. Today we're going to be looking at enrollment for the drug Medi-Cal using the PAVE online system, and we're going to be doing this in partnership with DHCS. So we're very excited about today's session. Just as a small disclaimer, this training is offered through the Community Mental Health Equity Project, the TA Center, which is funded by DHCS and administered by CARS. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of DHCS. And in the case of any security issues that may occur, the session will immediately end and will not resume using the same join link. So we will send you a separate email with instructions on how to continue. We want to thank our multidisciplinarian team. We have SSG and Cal Mesa here with us today. They have been partnered for most of this series, so we want to give them special thanks, but thanks to all of our partners in the CMEP project. A little bit of the core values of the CMEP project is it's equity-driven and anti-racist, strengths-based, trauma-informed, lived experience, community engagement, collaboration and knowledge transfer, and data for equity. And that's something that we expect from our participants as well in this space. So we want to make sure that everybody that's communicating is using their pronouns and making sure that we are being trauma informed and aware of the different people that come into the space. And I am going to go ahead and pass on to our today's presenters for them to give a little bit more information about themselves.
I'll start us off really quick. Just want to share, my name is Nicole Mesa, but I go by Nikki Mesa. I am a section chief in the provider enrollment division in the application processing section. And I'll hand it off to my other co-host, Leslie.
Hi, everyone. This is Leslie Fair, and I am also section chief with application processing with the Department of Healthcare Services.
Hello, everyone. This is Trang Huang, she, her, hers. I'm with Special Service for Groups, and together with Cal Mesa, we've been helping CARS working on collaborating to organize the speakers, presenters, and content for our series.
Today, we have the learning objectives of standing the Medi-Cal program and provider enrollment process using the PAVE system, learning how to set up your PAVE system, including the application process and the required documents, and then review the drug Medi-Cal requirements and laws as they impact this process. So for the agenda today, we have laws and requirements of drug Medi-Cal, application fees, fingerprinting, getting set up in the PAVE enrollment system, documents to attach in your application, an overview of the provider enrollment process, and additional resources. So drug Medi-Cal provider enrollment. This is a comprehensive overview of the requirements for the enrollment of drug Medi-Cal, DMC providers. The application process is completed online in the PAVE enrollment system, and this is a link that you can access that here. And we no longer accept paper applications for drug Medi-Cal enrollments. So what is drug Medi-Cal specifically? It's a treatment funding source for eligible Medi-Cal members. It allows for drug Medi-Cal to pay for covered services. Eligible Medi-Cal members must receive substance use disorder services at a drug Medi-Cal certified program. Such services are funded by drug Medi-Cal and are listed in Title 22, California Code of Regulations, Section 51341, Title 9, and Title 22, California Code of Regulations. They all govern the treatment of DMC providers. So DMC billing, how do you bill for these services? So drug Medi-Cal clinics bill through a contract with their county, or they can also bill through a contract with a Medi-Cal managed care provider. Apologize for that. So what are the levels of authority that we have? So provider enrollment requirements are based in federal Medicaid law, California Code of Regulations, state Medicaid statutes, state regulations, and DHCS regulatory provider bulletins. And all of these can be found on the Drug Medi-Cal website under provider enrollment, Department of Healthcare Services. The federal Medicaid laws are contained in Title 19 of the Social Security Act and Title 42 of the California Code of Regulations, federal regulations, excuse me. And I apologize, it's Code of Federal Regulations. So it's under chapters 1, 4, and 5. And some of the major points to remember are federal law holds DHC responsible for collecting specific information from providers regarding ownership, control interest, adverse actions, and participation. State agencies shall not enroll anyone excluded from Medicare or other state Medicare programs. The California law statutes are the California Welfare and Institutions Code, and it contains rules for social welfare and government healthcare programs. The W&I Code sections 14043 and 14045 govern Medi-Cal provider enrollment. And then additional governance can be found under the Health and Safety Code, which governs physical safety standards for substance use disorder services in California. The Business and Professions Code contains the laws that govern the professions in California. The Corporate Code contains laws for the structure and operation of legal entities in California. Some additional regulations are substance abuse treatment providers participating in the Drug Medi-Cal program must follow the requirements contained in the California Code of Regulations under Title 22. Narcotic treatment programs regulations can be found in CCR Title 22 and Title 9. And then in addition, DHCS has published regulatory provider bulletins that can be found on the DHCS Provider Enrollment Division webpage. And this is a link to that. So what are the entity types that can enroll as a DMC provider? So applicants or providers can apply using their Type 2 National Provider Identifier, except for sole proprietors, and those providers have to use their Type 1 NPI. But the different entity types that can enroll as a DMC provider are limited liability companies, corporations, partnerships, government entities, nonprofit corporations, and sole proprietors. So service modalities. Service modalities are services provided by a substance use disorder clinic. The types of services include narcotic treatment program, intensive outpatient treatment, outpatient drug-free, residential, naltrexone, heroin detoxification. And then all of these have something called treatment components. And they include perinatal, which is services provided to pregnant and postpartum women, and then non-perinatal, or both perinatal and non-perinatal. The licensing requirements. So the following license need to be first be obtained from the Licensing and Certification Division of DHCS. And they are residential, narcotic treatment program, heroin detoxification. But more information about licensing requirements can be found at this particular website for Licensing and Certification Division. But it's important to keep in mind that new regulations are always developed and they may arise in the future. So it's important to keep up to date with regulations that can affect DMC providers. Modalities. So peer support and care coordination. We've all heard about those, but there's currently no pathway to only enroll peer support and care coordination services under the existing modalities that I showed you on the previous page. However, these services can be included on your county contract if you're providing one of the other modalities. Established place of business is one of the items that providers have to meet when they enroll. So they have to be open and operating as a DMC provider at the time that they submit their application. They have to be either own a building that they're currently residing in, or they have to be leasing that building. And then they have to submit all local and business permits, state and local business permits and licenses to conduct business. They also have to have general liability insurance and workers' compensation insurance as it's required by state law. And they have to have administrative and fiscal foundation to survive with adequate staff for the volume of business that they perform. So there is another place of business that they could, and that's what we call that they can provide services at, and that's called a school site. So if the applicant indicates that the service address is located on a school site, they are required to submit 2 cover letters, one from the principal or equivalent, and another is from the school district. An additional cover letter from the superintendent is required confirming permission for the DMC clinic to operate on school grounds. And each cover letter must be on the letterhead of the school. And school sites are exempt from general liability insurance requirements. However, they are still required to have a business license if it is required by their county or their city. Donated spaces is another option. If the applicant or provider is a substance use disorder clinic located on a space donated at no cost, they must show that they have obtained verification from the space owner that they are authorized to use the space to provide substance use disorder services. A cover letter is required and must be on the donor's letterhead, along with listing the service address and services provided. All established place of business requirements must be met. For example, a nonprofit church lends the applicant an office space for counseling services. That needs to be documented, and they still need to have the business license if it's needed and deemed necessary, as well as general liability and workers' compensation. Some additional information for DMC providers. All DMC clinics are required to submit a linked substance use disorder medical director. It's what we call a SUD-MD. And they need to submit the SUD-MD rendering application to affiliate the medical director to the clinic. A SUD-MD is a physician licensed by the Medical Board of California or by the Osteopathic Medical Board of California. And each substance use disorder clinic shall have a licensed physician designated as a SUD-MD, who is an agent of the substance use disorder clinic, and they're required to show evidence of current malpractice insurance. All DMC clinics will need to disclose an executive director or a clinical director in the ownership and control intersection of the PAPE application. An executive director is defined as an individual who has the authority to make executive and managerial decisions for the organization, company, or department. Usually this person is designated as the president, the director, or CEO of the corporation for the drug Medi-Cal clinic. The application fee. So each year, the Center for Medicaid and Medicare Services determines the new application fee amount. The application fee for 2023 is $688. The current fee information can be found on PED's application fee website. This is here, and payments can be submitted electronically through the PAVE application. So there are exemptions to the application fee. Drug Medi-Cal providers may be exempt from paying the application fee if they meet one of the exemptions below. The applicant attaches a Center for Medicaid Medicare Services letter indicating they have paid a fee to CMS. They provide exempt by waiver pursuant to federal law. Waivers are not approved by DHCS. DHCS will forward the request to CMS for approval. And then note that the application cannot be reviewed until CMS has approved the fee waiver request. However, the provider may submit both an application fee and a fee waiver request in order to allow their application to be processed without waiting for CMS approval. If the waiver is granted, a refund will be issued. And one thing to note is it can take up to 60 days for CMS to approve your application for a waiver or deny the application for a waiver. So application fee waiver request. To request a waiver, the provider must include with submission of the application a letter that describes the hardship, the justification for an exemption, and supporting documentation. Acceptable justification documents may include historical cost reports, recent financial reports such as a balance sheet and income statements, cash flow statements, most recent tax returns, and other profit loss statements for the location. And this is depending, the location is the service address that the application is submitted for. So risk level. Excuse me, my allergies are bothering today. Risk level designation for opioid treatment. Effective April 10th, 2022, there was an updated designation of categorical risk levels for the drug Medi-Cal program. The Center for Medicaid Medicare Services has designated newly enrolling opioid treatment programs as moderate or high categorical risk. That subjects them to the providers to additional screening requirements according to the date that they were fully and continuously certified by the Substance Abuse and Mental Health Services Administration, SAMHSA. So this applies to all providers that are enrolling or providing services such as narcotic treatment program and heroin detoxification programs. So the categorical risks are moderate and high. So moderate would be any individual or any entity actually who's submitting an application that is enrolled previous to, so before October 23rd, 2018. There are newly enrolling DMC applicants and enrolled providers adding NTP or HTP services. And the moderate risk level means that they are submitted for an on-site through audits and investigations. High, if you're a high risk, if that's anyone who is on SAMHSA after October 23rd, 2018. And these providers are submitting applicants, they're newly enrolled DMC providers with NTP or HTP services, applications or supplemental changes from adding NTP or HTP. And this requires a criminal background check, which is a CBC live scan or hard copy fingerprint card. And this also means audits and investigations referral. So just to explain that a little bit, so let's say that we have a provider who's currently enrolled at a specific service address. They've been enrolled for quite a while. However, they've decided to add NTP services. So because they've been enrolled they were enrolled before October 23rd, 2018, and they're adding NTP services, they are considered a moderate risk. Let's say that they are submitting a supplemental changes, but they have been enrolled after October 23rd, 2018, even though they're still an active provider with a different modality. If they're adding NTP or HTP, they are now considered high risk. So fingerprint requirement for high risk providers. If DHC determines your DMC clinic is at the high categorical risk screening level, DHCS shall conduct a criminal background check and shall require submission of a set of fingerprints in accordance with Section 3100 of the Penal Code. When fingerprints are required, any person with a 5% or greater direct or indirect ownership in a provider applicant must submit fingerprints for a criminal background check in the form and manner determined by DHCS within 30 days. In order to obtain the required fingerprints, you have to present a pre-filled Department of Justice request for live scan. It's called a BCIA 8016 form to a live scan operator and pay the applicable fees. When submitting the application, include a legible copy of the date-stamped BCIA 8016 form, along with verification that all fees have been paid. And typically that's either a receipt that's stamped paid or some other, or just the document, the live scan form that has stamped paid on it. Please note that nonprofit organizations and government entities are not required to provide the criminal background check, live scans, or hard copy fingerprint cards. Out-of-state fingerprint requirements for high-risk providers. If an individual is located out of state, they're required to be fingerprinted using hard copy fingerprint cards and to complete a pre-filled request for exemption from mandatory electronic fingerprint submission requirement. That's the CJIS 9004 form. For more information and instructions for individuals who are located out of state, please see this provider bulletin, and that will give you all the information that you need. So now we're starting the application process. So the next set of slides guides us users in getting set up in PAVE enrollment system and then completing the questionnaire to start a DMC application. And Nikki's going to take over from here.
Hi, everyone. Here is the screenshot that you will see when you first access PAVE. I do want to add just a little bit of a disclaimer here that images are subject to change as PAVE is always making modification and improvements. So sometimes the visuals can differ a little bit depending on if you refer to this presentation at a later time. So just adding that in there to keep in mind. So this is the link to the Pave portal login screen, and we'll go ahead and go to the next slide. And to begin, you will click the sign up, pretty straightforward. We'll go to the next slide. And on this page, you will then be directed to sign up and enter in all the required information. So what's important to remember here is to make sure that you're setting up your user profile with your own personal email address. You don't want to set up your username with a shared email box or an email that you don't have full access or permissions to, because this user profile really belongs to you, the user. And so it'll always be tied to the individual themselves. So if you leave your current company and begin to work for another organization, it's just a lot easier to make the switch if you're using, if you set up your user profile with your own personal information. Next slide. And after you submit your information, you will be prompted to enter a 6-digit verification code, either by call, text, or email, just kind of like any other process. And this is kind of what this message will look like. And it's just important to note that the verification code will only be valid for 15 minutes. Next slide. And this is where you'll enter it in. And once you click verify, it will go ahead and go to the next slide. It will take you to your success. You did it, just like anything else. And you'll hit that begin button. Now here is where it gets exciting. So you'll enter your email and password to log in. And now that you're all set up as a Pave user, this is where you'll get to create your actual business Pave profile, which is a workspace where groups or individual providers can create the actual application themselves and manage their accounts. So here are the steps for getting your Pave business profile set up. You will make sure that you're logged in with your user email and password. And you'll enter the NPI and click verify. Once the NPI is verified, you will enter the Pave profile name that represents your organization and click on create my Pave profile. And it is recommended, like I said before in the previous slide, that you use a personal email, especially for our rendering providers that Leslie had gone over, the SetMDs. Versus a work email, as the Pave account may need to be used for different locations where the individual might work. So there are, definitely situations where SetMDs can be employed at different organizations. So making sure that they're setting it up under their correct profile. Okay, so now you are in and you have your business profile set up and linked the NPI. This is the screen that you will see. The highlighted arrow above is pointing to the name of the business, from where you can click on different options from anything that you would like to do. So up at the top, you can select applications, accounts, or my tools. And the buildings are not highlighted below are also another avenue for those same options. So just kind of two different visuals there. My tools is essentially your settings for the account. Accounts is where you can link and make changes to any enrolled accounts. And the application tab is where you can get started with any new applications or view any applications that are in progress. Additionally, there are 2 buildings highlighted below, which are the message center, where you can see any Pave messages regarding your applications, as well as a learning center, which has some great tutorial videos that are specific to Pave. So now that you've learned how to get in and set up in the system, we'll get right into beginning your DMC application. So in your Pave profile, click on applications and then click on new application. And you will then complete a questionnaire to start the correct application package. The following slides are going to guide for how to move through the questionnaire to start the DMC application. And then one thing to know, this is the pathway that would be used for someone who is not already enrolled or who was previously enrolled in Medi-Cal but doesn't have a current active account. The same pathway would not be used for someone who is an existing provider who's already in our system. So this is just for new DMC providers. So we'll walk through this on the next set of slides. Okay, so here is the first questionnaire page. One thing I'd like to highlight is that this questionnaire page is actually what builds your application. So it is very important to take your time with this area, as this information selected and entered in the questionnaire portion cannot be changed, unlike everything else that's within the application itself. So if there's any incorrect information, it'll build your application package incorrectly. So it's not hard, but very important just to take your time with these questions. So as you can see from the screenshot, first you'll select I'm new to Medi-Cal and want to create a new application. And then a DMC would be considered a healthcare business. So you're going to select I'm a healthcare business. Okay, and then the second questionnaire page, this is where you will select the appropriate business structure for your entity. And here you have the option to select a sole proprietor or other entity. So it's important to note that all entities, even if owned by only one person, would need to select other entity if they're organized as a corporation, LLC, partnership, nonprofit. Those are all an entity. A sole proprietor would just be an individual person. And again, this is not a selection that can be changed after the application is created, as this information is what builds the application. So important to take your time with this question, as this can kind of stump people sometimes. Okay, sorry, next slide. This next page is where you will enter your NPI, and the correct NPI type just depends on your business structure. So a type 2 NPI is for business entities such as corporations, LLCs, nonprofits, and partnerships. And they must use a type 2 NPI even if you are the only owner of the entity. A type 1 NPI is used for sole proprietors. And a sole proprietor is a business owned and operated by one person, and the business and the person are one and the same for income tax reporting. This is what the page looks like once you enter the correct NPI, and you will click verify. And the system automatically generates a summary of what that NPI looks like on NPES. So it's doing actually a little double check for you, which is very helpful. For example, if you were to transpose a number, it would either come up with no results or come up with like another unrelated entity. So it helps you double check that this information is correct before proceeding. Sometimes we have seen for some larger entities that people can mistakenly put in the wrong NPI for that location, but it belongs to the same entity. So just always a good idea to double check the information entered before proceeding. And on this page, this is where you select your provider type, which for this case would be a drug Medi-Cal clinic or DMC. And this last page captures what languages are offered at that clinic. Okay, and then this is the final summary page that will show you all of your selections. So at this point in the process, if you recognize that something's wrong, you can go back to the previous page and edit your selection. And then if everything is complete, then you would hit continue, and then your DMC application will generate for you. So now we're just gonna go into some of the required documents for DMC providers. This is not an exhaustive list and is subject to change based upon statute and regulation changes. But you would need to include articles of incorporation if you are incorporated, state issued identification, an IRS document for verification of your TIN or EIN, a business license or tax certificate if it's required by the city that you are doing business in, a fictitious business name statement if using a fictitious business name and if it's required by the county, a lease agreement if you are leasing the service location, workers' compensation insurance, proof of general liability insurance or comprehensive insurance, and NTP or heroin detoxification or residential licenses if providing those services, and a cover letter if the service address is located on a school site or on a donated space, just like Leslie went over in her previous slides. Okay, so once your application is ready and complete, you will submit your application to DHCS. And from that point, we have 180 days to perform our initial review. However, we do strive to complete the application review much sooner than that. So we'll go through each of the possible avenues that the application can take after the initial review is complete. So one of the avenues is correcting any deficiencies. So if your application is incomplete, DHCS will return it to you to fix for corrections. You will be notified via email to log into the PAVE system to fix the noted deficiencies in your application. And you will need to go into the application and make the corrections and then resubmit your application back to us within 60 days. Common deficiencies include incorrect insurance documents, service addresses don't match on the insurance documents or business license. The documents are expired before the application was submitted. Not disclosing all individuals that have 5% or more ownership or control interest. And along the same lines, not disclosing all board members, directors, or managing employees. And also having an unauthorized signer sign the application who doesn't have authority, and it cannot be delegated to another individual. Another avenue that the process can take is an on-site inspection. So it could, your application could get referred for an on-site inspection for any reason, but if it's determined that the DMC clinic is at a moderate or high categorical risk, on-site is mandatory. So you will get that inspection no matter what. You will be notified of this through the PAVE system. And you will be contacted by the on-site staff who may ask for additional documents to verify information in the application package. And another avenue is for approval or denial. So if your application is approved, you will be notified via email to log into the PAVE system and receive your approval letter. And if your application is denied, you'll be notified also through email to log into the PAVE system and receive your denial letter, which also will include appeal rights. So this next slide is just a bunch of additional resources that could be helpful, including our PED regulations and our DMC provider bulletins that give our authority, and as well as additional resources on that last slide, and as well as our PAVE help desk number, which is a direct call center in case you're having any technical issues with the PAVE system. All right, that completes our presentation today.
We wanted to pause and see if we could field some questions. So this might be a really good time to either type your questions in the chat That's great. Okay, we are getting some questions.
So it looks like we have a question from Carlos in the chat. In order to complete the DMC application, do we need to have a licensed physician on board?
So this is Leslie, and yes, you do have to have a licensed physician as the SUD-MD on board. And that should be submitted, that application should be submitted at the same time that you submit your DMC application. So in regards to how much does the DMC application differ from the standard Medi-Cal application, it's a different pathway. You're doing other healthcare, which in most of our standard Medi-Cal applications, there is no application fee. There's just a couple of other provider types that have an application fee. The other difference is that we have a SUD-MD that needs to be, that application needs to be submitted along with it. So it is different than the regular Medi-Cal application if you were just submitting a group application to enroll a bunch of providers that are enrolled under one group. And then it says also for the new mobile crisis team benefit, do those teams need to register for DMC in order to receive reimbursement for responding to substance use crises? Right now, that would need to be included under your county contract. There is no direct pathway for mobile crisis team at this moment, but that could be included in your county contract when you're providing some other. So in other words, you could submit a DMC application for outpatient drug-free, perhaps, if you had if you had a county contract and you wanted to do the mobile crisis team benefit as well. I hope that answered your question.
Actually, Leslie, that's really interesting. Can you repeat that last one again? So if
So for his question was also for the new mobile crisis team benefit, do those teams need to register for DMC in order to receive reimbursement for responding to substance use crises? So we currently don't have a direct modality. Remember when I was going over the different modalities, that was naltrexone, heroin detox, narcotic treatment, residential, and outpatient drug-free and an intensive outpatient treatment. So those are the only modalities that are included under the Drug Medi-Cal program. However, like care coordination and peer support, if you have a county contract, the mobile crisis team benefit could be handled under your county contract as long as you had one of the other modalities listed. Then you would submit a DMC application. So the additional question is, but the outpatient SUD treatment would be distinctly separate from the mobile crisis team benefit, correct? Yes, it would be. And that outpatient SUD treatment would still require a SUD-MD. That is correct. So if you're going to be doing the mobile, you'd be doing essentially outpatient drug-free. So that would be what you would include in your county contract, and you would still need the SUD-MD.
we have several participants from other counties and in a variety of different roles. So even if you're not at the point where you're registering and pay, but if you have some general questions too about SUD-MD, you can also just sort of pose the questions since we have our two experts today.
Hi, ladies. My name is Rowena Rucker. I'm with NAMI Urban Los Angeles. So naturally, I get a lot of phone calls from families and peers who are looking for resources where they can actually use their Medi-Cal. So anything that you ladies can assist me with, it would be most appreciative because I'm bombarded every day. You know, they call me looking for answers. And I don't have the answers. So whatever I can get and collect from you would be greatly appreciated.
Yeah, we do have a list of our DMC providers on Open Data Portal. Trang, we can also send you a link to that, and you can include that in the resources as well. I believe with that, you can filter by your city or county and get a comprehensive list of enrolled providers in that area.
Rowena, this is Susan with Placer. We have recently worked with a group called Shatterproof, and they have worked with both DHCS and the counties on a website where you can, our clients, family members, or even yourself could go to find resources, and it does include Medi-Cal providers as well. I believe the address is, the website is treatmentatlas.org. I can put it in the chat for you, but that also might be another good resource.
Thank you. Anything, everything helps.
I think our purpose in pulling together the series is to learn from folks like Leslie and Nicole, because this is the material, the information that is really what we need to follow to go through. But it also, this is a learning collaborative. So our goal was also begin to sort of have a group such as yourself who are going through the process of certification, who are preparing to share resources like what you've just done, and also to ask questions that might help folks who may be a little bit earlier in the process to begin to anticipate the question, the issues, sort of like similar to Carlos and Jacob's questions earlier. So please feel free to voice it, share it, ask the questions, and also just share with us as well. And then anything that is shared with us, we try to send it out to everybody else, because this is it's called the Regional Learning Collaborative. And that's how we hope to design it, is to make it as learning opportunities. Okay.
And even if people don't have questions right now too, if anything comes up, we do offer totally free TA support services as well. So, but those are available anytime. So if anything pops up, you can reach out to us as well.
Okay. All right. So we know we can always try and get in touch with Leslie or Nicole over at the HCS. Thank you for sharing the resources for us. And we know now that we can email and have access to support in our process. Thank you to our presenters today. And your materials will be distributed and shared. Thank you, everyone, for joining us. And please let us know after. Feel free to email us at CARS, and we will respond based on your specific inquiries.
It was a pleasure speaking to everyone today. I look forward to hearing from some of you in the future.
Yes, thank you all. We really appreciate the time.